subscribe now and press the bell icon. Never miss an update.
Welcome to Health Live at Seniors today. We are delighted to have here with us Dr. Sanjay Helale. Dr. Sanjay Helale is a senior ENT consultant at the Nanavati Max Hospital in Mumbai. And, as it happens, even though it's a holiday for many of us, Dr. Helale had to go to the hospital and he's on his way back home. And he will join us with a presentation from back home. But we just troubled him and we said, let's, request you to come online and speak to us, and then we can get into the presentation. So a little about Doctor. He has, as I mentioned, over 26 years experience. He's a senior ENT consultant with the Nanavati Max Hospital in Mumbai. Earlier, he was ENT consultant at Fortis in Mumbai and at Apollo Hospitals. And he was also with the Bhabha Memorial Hospital in Kurla. He was an ENT consultant with Fauziya Hospital way back in '98, and before that, as a lecturer in MGM Hospital in Parel and in Aurangabad. He has done his MS in ENT. He's done his transoral robotic surgery from the US. He has done a transnasal endoscopic skull-based surgery under Professor Ricardo Carnau in the US again, and a clinical fellowship and hands-on training in lateral skull-based surgery and cochlear implant surgery from Italy. His areas of interest are coblation surgery, cochlear implant, head and neck tumors, laser surgeries, micro-ear surgeries, mycocormasis, that is black fungus, navigation-assisted ENT surgeries. Well, those are hardcore ENT issues that doctor has been doing. But the topic that we have, that the doctor suggested we look at today is risk of fall and prevention in senior citizens. Risk of fall and prevention in senior citizens. And, we all know over here how much this matters to senior citizens. The risk of fall is definitely there. There are, ear imbalances and various things that happen. And while, as I mentioned to you, doctor is in the car, you can see him all belted up, and he's on his way from Nanavati Hospital to his home in the eastern suburbs of Mumbai. And until he reaches home, we will engage with him in some conversation. And once he's back at home, he will connect to his laptop and speak with us. Dr. Helale, how have you been?
Yeah, good evening, all of you.
Good evening. I'm sorry that this is there, but
no issue. I'm happy.
You were attending to patients, and that's what's most important. Dr. Helale, before we start and before we get into the topic of discussion, do you feel that the issue that you're discussing today, which is falling and various issues that concern that are caused because of ENT disturbances, is that number increasing in the recent past, or has that has it reduced because of medical advancement?
Has actually increased, and that's because of the nuclear families which are coming in, and the supportive care which the senior citizens staying alone and the kids settle abroad, that incidence is increasing. But it's a totally preventable problem. So I wanted to touch upon this because the senior citizens, with some cautions, they can say they get injured and they are not attended on the time. And there is enough preventive which you can talk about on the fall prevention. The people around may be wondering what the ENT surgeon is, how is he involved in fall prevention? So to your surprise, our statistics of CDC, 60% of them, the fall is because of the balance system, which is situated in the inner ear, becomes weaker and weaker as age advances, as the hearing also becomes weaker and weaker. So two sensory organs situated in the ear, balance and hearing. If both the organs become weak, then the remaining like vision and the brain, which participates into normal balance mechanism, they also get compromised. So the entire balance system, which 60% is contributed by inner ear, that also goes weak. So we need to focus upon what can go wrong in the inner ear, which can lead to the fall, how that can be diagnosed as early as possible. There are certain causes which are curable, they are reversible, which are associated with the senior citizens. Say bilateral vestibulopathy means both the inner ear functioning needs to be monitored, like a hearing we monitor every year for the senior citizens, which is an ignored area, which I want to highlight on that. At the same time, there are certain uh, conditions of the inner ear which are common in the elderly, like we call it as a benign paroxysmal positional vertigo, BPPV, that is more common in elderly, but that gives a spinning sensation where the person doesn't have time to recover themselves and they fall, and the injury which fall induces is much more serious and grievous than the problem itself. So I thought we should touch upon these areas because the more and more nuclear families are coming in, and more and more senior citizens are staying alone.
Right. Doctor, you mentioned about getting a ear checkup, your hearing checkup done every year, annually.
Yeah, right. Above the age of 70.
Above the age of 70. But, as I can see that there are people who are above 60 and, sessions on ENT are, people have made several requests at our forums to have sessions on ENT. So is that something that, one should start looking at even above the age of 60? Is that, or is 70 good enough?
No. When it comes to hearing assessment, it should be done above the age of 60 every year. It's an annual health checkup. It's like a vision checkup. But when it comes to a balance function, it should be above the age of 70 regular, unless they have some symptoms of the history of fall or history of ear infection or some sort of balance disorder, but their balance remains quite good till the age of 70. So after the age of 70, unless there is some risk factors, a regular preventive balance checkup is not required.
Right. And but would you say that somebody who has had a balance issue earlier on in life, say at the age of 50 or whatever, could have perhaps other problems coming up later in life? Is that something that can happen?
There are certain situations which are high risk factors, which say the patient had a meningitis with an complication into inner ear infections. Patient had the medicines, they say sedatives and antipsychotic medicines, a lot of sleeping pills or something. They need early evaluation for the balance dysfunction, because the sedation induced balance disorder can also has an equal amount of risk regardless of the age.
Right.
So stressful living with the anxiety disorders, and they sleep only with the sleeping pills, they also need some balance organ to be evaluated.
Doctor, we have a question that has come in. How far are you away from home, doctor?
I'm not too far, but the traffic is very, very bad.
I can imagine.
I'm just, I would reach home faster than the car, but if I go walking, it's just, we are just crippling.
I can imagine. So, doctor, I have a few questions that have come in. If you don't mind, we'll take that, and then this is not concerning the topic of your session today, but this is Mr. Vasudev.
So anybody can ask any question, whether all ENT related senior citizen problems, no issue.
So this is Mr. Vasudev. He is 75.
Yeah.
He has the following ENT problems in the last 6 months, which is tinnitus, hearing loss, blockage in both ears, heavy headedness, vertigo. he's consulted doctors and he's attached his report, but we don't share reports like these with doctors.
Okay.
Not much relief. Is there something that you can provide a solution for? He's in Delhi, so or his doctor is in Delhi, and I'm sure he could get great help there. But he still wants to know.
I agree. But what he should be doing, he should get in touch with the proper vertigo clinic than going to the general doctor, like general physician or the general ENT who is not looking into balance clinics. And he needs the functional evaluation of his balance system. So there is one way, that is structural evaluation by doing MRI, CT scan. Is there anything structurally happening? It's like a tumor disturbing the function or something. Once that is ruled out, then what remains is a functional evaluation. So how do we see the heart is functioning or not? It's we do ECG. And how do you know the structure of the heart? By doing 2D echo. Similarly, for the balance system, we do MRI, CT scan, whatever is required in that particular situation to know the structural integrity. But whether that structure is actually functioning or not, these images are not going to tell us. We need a proper evaluation in terms of, say, vestibular nystagmography, video nystagmography, which is called as VNG. There are similar tests which can tell us how much is the balance function and what is the problem, and have to locate, pinpoint the problem and treat specifically. So he should go to the vertigo clinic.
Now, actually, he has gone to a fairly well-known ENT specialist in Delhi, because I can see the prescription. But Vasudevji, the video of this session is going to be there on our website, the SeniorsToday.in website, on Monday in the second half. So you can have a look at it. What doctor has advised is available there. You can also get in touch with Dr. Helale at the Nanavati Max Hospital, which is part of the Max Hospital, which you have in Delhi as well. You can contact him at the Nanavati Max Hospital in Mumbai, and I'm sure he could, you could have a teleconsult with him. Doctor, we have two more questions that have come in. One is Mr. Sri Krishna Agarwal, who is age 76. He suffered pharyngitis last year. He's got allergic rhinitis with running nose. Laryngoscopy 6 months back, which has given sulcus vocalis, change of voice and slurring. Small mucosa just above the left vocal cord. Edema, antenoids. Is there any cure for change in voice and slurring? He asked, without going for surgery. Is there any medicine, humming exercise to cure symptoms now, or to contain further deterioration? This is Mr. Sri Krishna Agarwal. He's age 76. Doctor, you must applaud like him who are amazing. At age 76, you would think that people are not on Zoom and on the computer, but
I agree.
A detailed description. So first of all, Mr. Agarwal, thank you for being so active, and I know you are active even earlier. Over to you, doctor.
Because he has given me the diagnosis of sulcus vocalis. Sulcus vocalis must be a gross voice disorder. There are a lot of non-surgical options for him. There is some injection laryngoplasty, which is a non-surgical and office-based procedure. Second, if he is okay with a very short surgery, very daycare kind of a surgery, where his sulcus vocalis can be, that the sulcus can be elevated, can be done with a microsurgery. But if he doesn't want surgery at all, then injection laryngoplasty is an option open to him. If he goes to a phonologist or phonosurgeon, they do it on office-based procedure. But provided he has done adequate voice therapy and voice therapy has not given him results, then that's an option is open for him, which is non-surgical as well.
Right.
Yeah.
Thank you, doctor. Doctor, we have a question from Mr. Narendra Shah. who's 71. He says, when I sit under the fan, I get a headache and feel uncomfortable. What is the reason?
So there is something called as vasomotor rhinitis, which can cause nose block, discomfort, and it gives rise to a syndrome called as myofascial syndrome. This is a myofascial pain syndrome. So a nose has a very sensitive for temperature. Nose tissue is sensitive for variation in the environment. It is different from the allergy. It is sensitivity. So the sensitive nose can have a symptom of, say, when they're exposed to the ear blast, to the AC or the fan or something, then the tissue swells up. And that leads to a discomfort and sometimes suffocation and the pain in the facial region. So this is called vasomotor rhinitis. And if the symptoms are mild or moderate, I think he should not be doing anything for that. If the symptoms are intolerable, he can use some topical sprays, no oral medicines, because this is the sensitivity problem, which are going to be there to desensitize the nose. Temporarily, when he has a severe symptom, there are the sprays available. He can use topical steroid sprays and the manage spray and the pray.
Right. Thank you. Mr. Sri Krishna Agarwal, you want the name of the injection repeated? As I mentioned, the video will be there on Monday, but since you've asked, can I request Dr. Agarwal to once again give you the name of the injection that you had given, Doctor?
Actually, it is the injection could be fat. It's a prerogative of the phonologist, that particular doctor who is comfortable with which injection. Maybe fat injection, his own body fat can be injected. There are some liquid silicone injections are also available. There are hydroxyapatite injections are available. But whatever is comfortable between that phonologist and the patient, that should be considered. Fat is natural. His own body's fat can be taken out and injected.
Doctor, we have a question about the new coronavirus vaccination that has come in, which is a nasal spray. So the question is, while one hasn't taken the vaccination yet, but if one does take it, can it impact the nose in any way?
No, it will not impact the nasal function, but as of now, all studies are not yet available on it. What will be the side effects and the long-term side effects of nasal spray?
Right.
There is enough study that they are effective, but there is no enough study to say that what damage it will come to the tissue. When it comes to vaccination and immunization of the person, there are enough studies that they are effective.
They are effective and they don't cause any other further damage.
Yeah, but so it really needs a post-market survey and the published studies to go through to say that they are completely safe for the nasal and sinus pathology.
Because doctor, this person has again sent a message. He says, every time I did an RT-PCR test before travel, and the object was inserted into my nostrils, I started sneezing a lot, and the sneezing did not go away for a long time. So there's no such. It's not something that is going to be inserted, right? It's just a drop or whatever is going to be put.
Which one?
The nasal spray that is there.
There's nothing to insert. It's just a spray.
Just a spray.
Yeah.
Doctor, we have a question from Katie Dadanchi. Incidentally, Katie Dadanchi, who's a resident of Mumbai, specifically wanted to be at your session today. And, she messaged me and I sent her the link. So her question is, Doctor, subconsciously, I tend to put my little finger in my ear during the sleep, and immediately I feel as if the room fan and the walls are spinning for some time, which settles down after a few hours. She is 71.
Yeah. So by putting the finger, he's feeling giddy, that he needs to be investigated. So there's something called as third window phenomena. Means the inner ear, the coverings of the inner ear as either uh, exposed, or this covering has become very thin. So the pressure in the ear is transmitted to the balance organ directly. So he needs to be thoroughly evaluated to rule out that anything which is happening in the inner, this thing, middle ear, causing some problem in the inner ears, like cholesteatoma in the ear disease, which causes erodes the bones and reaches up to inner ear. That needs to be ruled out. So he needs to be investigated, and this should not be ignored.
Right. Thank you. Doctor, we have another question which is there, which somebody has said that we have been advised in the past on the Seniors Today sessions that you should not use any earbuds, etc., to clean your ears. What is a good way to clean the ears? Because I live in a very dusty environment and I feel that there's dust getting into the ears very often.
Okay, so cleaning of the ear, what does the patient mean is cleaning of the wax? You know, the wax which goes into ear and the dimension of the bud is not enough to hook the wax and bring it out. It usually pushes the wax inside. That's the reason we don't recommend using the earbud for removing wax, which patient mean invariably removing of the wax and cleaning the ear. But to remove the moisture which goes after the bath, earbud is okay. When the moisture comes out, that can be mopped with the earbud, but not with an intention that wax will come out. When the wax accumulation happens, the earbud usually pushes it inside.
Right.
It's clear?
Yeah. Doctor, how much time do we have more for your destination?
I think I'm reaching home now in another 2, 3, 5 minutes.
Okay, great.
Now the traffic is eased. Now we are moving fast.
Super. Doctor, we have a question.
So I'm enjoying this station. Let's go ahead like this.
We have a question from Mr. Suresh Ghate, who's 70. He says, what are the basic reasons? And I know some of this will be there in your session. What are the basic reasons causing vertigo? How can it be prevented? I suffer vertigo once a year, he says, and cold and nose flowing, sneezes regularly. Whether disturbance in sleep is also responsible. For prevention, what treatment for vertigo is to be taken?
So it's a vertigo is like, you have fever and you take crocin and you get better, but the cause is not discovered. So vertigo is a symptom and it's not the disease. So we need to know what is the cause of the vertigo that particular the senior citizen is really suffering from, root cause of the vertigo. That needs to be treated. Only by treating the symptom, it will not suffice. It's like a vertigo. Vertigo, if you take medicines like to suppress the symptom, the underlying cause will flare up. And when at some point of time, it will be an intolerable thing. But it needs to be diagnosed properly because it's a symptom and it's not the disease. It's like vomiting. We have to find out the cause of the vomit. It's just like that.
Right.
Yeah.
This is the last of the questions that we received, but it's a very interesting question. Doctor, we have, and he is 67 years old, but it's an interesting question. Doctor, every summer we have a discord with my wife because of the AC running. I want the AC to be running and my wife doesn't want the AC to be running. And she says that she gets a blocked nose and she feels very cold because of that. Is there a solution that you have?
For the blocked nose?
For
I didn't get what is his major concern? Is the nose blocked?
His major concern is that he cannot live without the AC, but his wife has a problem because of blocked nose.
Okay. Yeah. So AC per se is not a problem. It's a temperature. So temperature about 24 should be comfortable for both of them. If somebody likes very cold temperature and other doesn't, then the problem. AC, whatever suits them, but the temperature should be around 24 or more. Now, if you keep the AC at 17, the sensitivity of the body will increase and they will have symptom. So AC per se is not a problem. What temperature they keep is a problem.
So, as you've seen, we've had Dr. Helale, who has been with us, and he will join us very soon once he reaches home. In the meantime, what I'm going to do is I'm going to ask our producer to show us a video of the latest issue of Seniors Today, which I would have shown you later in the program, but he's going to do that right away. Amazing. Even if I say it myself, it's a very good issue. It's what I would call an unputdownable issue because we have worked on the top 50 list for the last 4 months, and we were going to have it in our January issue, but we had a more topical, a better article which came in, and we decided to push it here. But those of you who haven't read it already, please go through it. This is available on seniorstoday.in. If you go to the seniorstoday.in website, you will find the link to that. You can also, this is issue number 44. So you can access all our 44 issues from the Seniors Today website. And you will be able to get all our content over there. And as you know, this is free of cost. You don't have to pay a single, as we would call it, naya paisa. Right? Now, naya paisa hardly has any value. So I would say you don't have to pay a single rupee. And those of you who have, I must also say this, that you can subscribe to all our content. You subscribe to all our daily newsletters, which will come to you every morning at 6:30 a.m. The link is there on the chat window. And those of you who would like to attend our sessions and who sometimes miss out on messages and all of that, or like somebody told me today that the link that was there was not clicking to the site. What you can do is you can pre-register. You can pre-register on for our health webinar, and the link is given there. What you just need to do is you need to fill up a form. It's a very simple form. We're not asking you for any information. We're not asking you for Aadhaar card details, nothing. You just fill in the form, and we will have you on our list. We are going to be having a session next week itself, which is next week as well, which is February 25th, and thereafter as well. So we will be there. You will be pre-registered. Pre-registration doesn't mean that you have to attend this, but it's just that you will get an intimation and you will be there in our list of pre-registered attendees, and you can always attend it. And do spread the word about this. If you want, you can copy this thing and send it across to people and benefit by, and let them also benefit by the session that we have. As you know, we have a session happening every Saturday at 5 p.m. We don't delay it. We don't start at 5:15 or 5:10 or 5:05. We start at the time. And, doctors also are so cooperative. You saw Dr. Helale, he was traveling from Nanavati hospital. We spoke to him, his office in the morning. He was all set, but then he was called to the hospital later in the afternoon. And then he was there, traveling from there to the hospital, to his home. And he joined us from there. So, these are things which are there, which happen. And but we start on time. Now Dr. Helale has reached home. As you could see him walk up to his to his home, and he will join us in the next few minutes. Those of you who have questions, you must put them across here to Dr. Helale. Lax, I can see you here. I know you've had questions to our ENT specialists in the past. If you have any specific questions, please put them across. And to all of you over here who are our regular attendees of the health webinar or of Seniors Have Talent, you should be here. So I'm going to give you a scoop news, as I say. Since I'm a journalist, I must tell you that our finale of season 10 is going to happen on March 5th. Our finale of season 10 is going to happen on March 5th, which is a Sunday. So here he is, and this presentation is also in place. Thank you, Mr. Pinto. Thank you. So, doctors in the house.
Yes.
Dr. Great, you are finally in your
Reach.
So, yeah. So over to you, Doctor. We will look at. We will. There are one or two questions which are still left, which we'll come to at a later time after your session. Over to you. Okay. So, Doctor,
I'll proceed.
As you know, is going to talk about risk of fall and prevention in senior citizens. And over to you, Doctor.
Okay. Thank you so much. Thank you for your kind introduction. So I'm a senior ENT consultant at Nanavati, and we're looking into a neuro-otology session which deals with the balance disorders and the investigations in the balance disorder patients. Falls among elderly is a far major issue across the globe. So 1 in 4 elderly person has at some or other time history of the fall, which is completely preventable. And it is a major health issue, even for the health sector on public health as well. But it is totally preventable kind of situation. There is a relation between the hearing loss and the fall. The hearing also gets deteriorated with the aging, so the balance organ. Both are situated in one tiny part of the ear, which is called inner ear, which is also called as a labyrinth. The two labyrinths together has a sense of hearing and the sense of balance situated in an inner ear, which gives a sensation of the balance and the information to the relevant part of the brain. And brain gives an information to a body to adjust the balance according to the instructions and the information received from the ears. So now we are talking about how the normal balance is maintained and what goes wrong to our balance system, which can give rise to a vertigo. And vertigo leads to the fall and its consequences. Are you able to hear me, sir?
Yeah, we are able to hear you.
Okay. So the commonest condition in an elderly, which can give rise to a very, very distressing symptom, is called as benign paroxysmal positional vertigo. This is an inner ear problem, which is totally curable, more common in elderly, and it has a very transient sense of rotation, which is associated with a change in position. The patient is either lying down or turning in the bed, or sitting or standing while bending. So that gives a very transient sense of vertigo, and that vertigo can lead to a fall in elderly. So this is one of the very common cause of a fall related to the inner ear problem, which is totally curable. We are talking about this condition and what exactly happens here. In an inner ear is formation of the crystals. The crystals are formed in the inner ear, and it is a part of a degenerative process. And that crystals can remain without any symptoms throughout the life. But if the crystal goes into a very sensitive area called a semicircular canal, that can give rise to a syndrome called as BPPV, which can be treated in an office. Patient comes with a severe vertigo and goes home without vertigo. It is as simple as that, but it needs to be diagnosed properly and treated in a proper manner. The Center of the Disease Control and Prevention has correlated the inner ear with an incidence of the fall and fall-related consequences. The increases for the fall in the elderly can be attributed in general with the aging and decreased activity, as well as and slow deterioration of the central nervous system, everything together. But one can be cured and tackled if the diagnosis is done on time and properly. Associated illnesses like arthritis that also contributes to the fall along with the inner ear dysfunction. over-the-counter medications for the cold, for sleeping pills, the medication for the insomnia, medications listing like say ingredients like alcohol, which cough syrup usually have. So these are the very commonly available over-the-counter medicines can contribute to the very serious problem. If this is causing drowsiness and it causes more drowsiness in an elderly person who has to get up in the middle of the night for going to the restroom. And if this can knowingly, unknowingly leads to a disorder called as dizziness, over medication dizziness, and that can also cause a fall and fall related consequences. So make sure that you seek an immediate medical attention when you had a fall, but much we will talk about prevention of the fall. The prevention lies in the evaluation of the function of the inner ear and strengthening the inner ear. So I'm just keeping some theoretical slides and we'll come to the practical. Now, along with the function of the inner ear, at the same time, we need to have your vision check, because vision, the body position, inner ear function, all together maintains our normal equilibrium. Look into what are the multiple medicines you are having, because you seek a consultation with a various specialists. And if the one specialist is not aware what other is prescribing, then the over medication can give rise to a problem, which is the drug-induced dizziness and the consequences. So we'll just focus on the preventive aspect of it. One is a measurement of the inner ear function. And inner ear disorders can be treated if they're diagnosed properly. And the important, there is no medicine which can bring out from the inner ear problems. We have to look into the specific cause and strengthen the inner ear function by giving therapies and exercises to a particular person. Apart from that, the other reasons which can cause fall is the fall of blood pressure. Your blood pressure medication, the blood pressure in a sitting and standing position should be measured. If the blood pressure falls more than 20, even if you are not feeling giddy, needs to be taken care of. Fall more than 20 in a systolic blood pressure from sitting to the standing position. To make the homes a safer living, you have certain common things which are to be followed. They should not be slippery surfaces. Use a rough surface. Keep the staircase and bathrooms well. They should be well enlightened. Keep the bathrooms dry. Use the handrails in the stairways and the bathroom. Cover the sharp edges of the furniture. Remove clutters. Keep the bed in a lower position to avoid falls. There should be always a light in a senior citizen's room. If you have a vertigo, it's imperative to watch out for the falls, the slips and other accidents which subsequently follow. This can happen because of the loss of balance, loss of hearing, need to avoid vertigo related injuries. So the take home message is falls are common and costly, but totally preventable. Targeted exercise that provides a high challenge to the balance system can be very effective. The balance challenging exercises can be incorporated into everyday practice. The older people may need an extra education and the support to maintain their participation. I think with this take-home message, I'm open to take questions.
Thank you, Doctor. Thank you very much. Doctor, we have a question which has come in from Mr. Lakshmi Narayan.
Yes.
And he says, this is Mr. Lakshmi Narayan, he's 67 and from Bangalore.
Yeah.
He has two questions, one a generic one, which is I have observed that whenever a person falls, whenever a person has a fall, invariably it's in the bathroom or the toilet. Why?
Yeah.
Why is it that falls happen mostly in the bathroom?
So when someone is using pressure, this is called as something called as syncope. Syncope happens with some induction of the pressure. So if they have enlarged prostate, they have to strain. If they have constipation, they have to strain. And the straining leads to fall in a blood pressure. That can also stimulate. If they have some inner ear problem, that problem gets exacerbated by using the pressure. Usually, these elderly patients in the middle of the night, when they get up, they go to the washroom. That is another reason it is more common in the washroom, because on the way or after reaching the washroom, they may face problem, the dizziness which is related to their overall, regardless of any cause. But the slippery surface in the bathroom is one of the major contributors.
The slippery surface in the bathroom. So good idea to have the anti-skid surfaces which are there.
Yeah, and there should be enough of the support railing in the bathroom itself. And there should be, the light of the bathroom should always be on for the senior citizens room.
Right. So there are quite a few interesting things which are there now. You have those hand grips which are available, which can be put in the bathroom.
Yeah.
I'm not a senior citizen, but I have done that because it just helps sometimes, because the bathroom can be slippery at times. So it's always good to do that. And of course, if the bathroom doesn't have an anti-skid floor, because and you don't want to get it done, there are various stickers and things that you can put up which have that.
So moreover, when they get up and they start looking at the switch to switch on the light of the bathroom, that itself, when that delays the light occurring, because vision is a very important support for them, along with other balance system. Vision is an important contributor to the normal balance. If that delays because of the switch is not easily accessible to his hand and lights are off, that also causes a fall.
Doctor, these days there are these movement sensor lights which are there, which when there's a movement, there's the lights, it lights up. Do you think that's a good idea to have?
Yeah, that is a very good idea to have. But the sensors needs to be, the sensors go out of order sometimes. So that also needs to be monitored properly.
Absolutely. With every new bit of technology, you also need to check.
It gets associated with some problem.
Right. Doctor, we have a question from two questions from Mr. Lakshmi. But the first one is that I have lost the sense of smell for over 2 decades. While it is an advantage that allows me to go through Dharavi without any problems, but it can be dangerous if there's a leakage of gas at home. Is there a cure for this?
No, because it's a very long-standing problem. If it is say acute onset, say maybe 2 months, 3 months of the problem can be looked into. But with the long-standing 20 years, that means there's degeneration of the nerve has occurred already. So 99% there is no cure to this problem, because it is a chronic problem and which is an irreversible stage now. So actually there is no solution to this problem.
Dr. Mr. Lakshminarayan is very dear to us. He's been a friend of seniors today.
And if he gets, some people get, say, they don't have a smell sensation, but that particular situation, they get a smell. That means the smell organ is alive, but there is something which is not allowing to reach that smell particles, that is a mechanical block in the nose can be taken care of. But if it is completely lost from last 20 years, I'm sorry, nothing can be done for it.
Mr. Lakshmi, you have a fair amount of good medical facilities in Bangalore, so you can, I'm sure, get that. Otherwise, the next time you are in Mumbai for one of your singing shows, you can hop across and meet Dr. Helale. He is in Nanavati Hospital in Villapale West, so you can meet him. We have another question which is interesting.
Yes, sir.
These are the days of earphones and earplugs for being hands-free when we talk on our cell phones.
Yes.
How damaging are these earplugs when they're inserted inside our ears of the or the earphone, which is round, bigger, one kept ear on the ears with the connector passing over the heart. When I use the earplug in one ear, this is Mr. Lakshmi again. When I use the earplug once again, I'm told it could damage or create imbalance. But before these smartphones came in, we had normal phones which used only one ear. So, what is what is your view?
So my view on this is try and use the mobile phone on the speaker unless you have something confidential which you don't want others to hear. Try and avoid these earplugs. The earplugs is delivering the sound right on the eardrum. That's one. Second, earplugs, they are not, sterilized always. That can introduce bacteria. Number three, if the earplug dimensions are not appropriate for the ear canal, it can injure, cause micro abrasion. And the elderly, I'll never recommend earplug because their system is so delicate. And once the infection occurs, it's very, very difficult to treat. And the elderly with diabetics can have a very serious problem, something called as skull-base osteomyelitis, stimulated because of the minor ear trauma. So I would never recommend to senior citizens to use earplugs. Earphones, yes, the bigger earphones they can use, but not the inserts.
And doctor, what about just keeping the phone like this? Because is there a problem with radiation, etc., even if you don't use?
So the using earphone close to the ear, I would recommend to use it on the speaker, keep the distance as away from the brain nervous system. It has an electromagnetic radiation, which can also in long run although there are no published studies associated with generation of say tumors, but there are anecdotal reports of the long-term use of earphone very close to the ear canal can give rise to stimulate genetic system for multiplication. So although there is a remote possibility of this very serious condition, and which is very difficult to treat in elderly, so I would recommend not to keep it close to the ear. Use it on the speaker, but it's not that hard and fast that you cannot, but try and avoid using it on the ear. Keep a safe distance and the speak.
Right. Thank you. I know, doctor, what you've prescribed here is exceedingly tough to implement, but
Yeah.
but that's what the doctor ordered, if I might say. Doctor, we have a question from Mr. KK Jain. He says, I feel severe dizziness and went through an MRI. Cervical was diagnosed. Still, there's no relief and I feel dizziness a lot. What should I do to reduce?
What was diagnosed?
Cervical.
Oh, see, cervical as a cause of dizziness is almost a non-existing entity, almost. There are very rare situations cervical can cause dizziness. The few decades ago, the cervical was, every dizzy patient used to have cervical collarbone. Now the science has advanced to prove or disprove what is causing the dizziness. Cervical is the rarest rare cause. And earlier it was supposed to be the commonest cause. The cervical to cause dizziness should be such a bad situation which causes impairment of the blood supply to the brain by movement of the neck, which is very theoretical situation, can cause vertigo. But by and large, cervical doesn't cause dizziness. So it is always invariably an inner ear. Inner ear is the commonest cause of dizziness in the elderly, and that needs to be looked into.
Right. Thank you, doctor. We have a question from, this gentleman who's 76 years old and from Delhi, who had some issues about his voice. His question is any vertigo hospital and doctors in Delhi whom you could recommend?
I think the AIMS has vertigo clinic, but many centers. Delhi has almost every Max has a vertigo clinic. Even many corporate hospitals has vertigo clinic. So
I think that's what it is.
yeah, dedicated vertigo clinic. There are many in Delhi.
Right. Doctor, you mentioned about earphones, big earphones, round earphones, which you are over the ear earphones. So Mr. Lakshman asks, how long can one use that?
So there is, when the earphone was introduced along with the mobile phone, was for the specific reason. But the use has extended to such a large, it was only, the mobile phone was meant for traveler's phone. Once you reach to the office, once you reach the home, you should not use mobile phone. Now the mobile phone as an integral part of your life, you can't keep it away. But rampant use of the mobile phone, earphone, it should not be more than 7 minutes at a stretch.
7 minutes at a stretch. Doctor,
Yes.
I must tell you, I must let you onto a secret. I have not had, but for when I was speaking to
And then again, I would recommend to use it alternately on the ear, not on both the ears simultaneously. And you give, say, if you're continuously talking on the earphone for 7 minutes, give a break for a few seconds. You can alternate ear. Say that is a break for the 1 year. That is very harsh to hear, but this is practical. It can happen. When I take a call, any message which I give, it doesn't last more than 3 minutes.
Doctor, you're a busy man. You don't have time to spend, and waste. But
sir, technology is important. It's precious. It is vital, critical, as an integral part. But use it judiciously.
So, Dr. Helale's message is only 7 minutes, right? 7 minutes on a call. Don't stick to 1 year. Go to the other ear as well. But that's the way it is. We have a question from Mr. Anand Narayan. What effect do psychotic drugs have on the balance, and from what age onwards?
So regardless of the age, all these antipsychotic which has sedation as a side effect has definite effect on the balance system. Say if you are taking the antipsychotic medicine and they are sedatives, they induce a sleep. And if you get up when you are sleeping, the chances of the fall is very high. So you adjust the doses in such a way, find out your active period of the day and the sleeping period. If you take these pills at the time of sleeping, so most of the sedation effects worn off during the natural sleep. This is how we have to, but all antipsychotic drugs has some or other, maybe minor, but it does have a side effect on the balance system. And that can be compensated, of course, by adjusting the doses, by adjusting the time, and along with the therapies, along with the exercises. But it does have. This is one of the high risk factors.
Right. Doctor, 2 more questions. I'm sorry. I know we have far exceeded time today. This is from Mr. S.E. Jain. Are there any exercises for the ears? He asks.
Ear means what exactly? For hearing or balancing?
For for everything. I guess, just to ensure that good year health. Mr. Jain, as you know, is 80 years old and he wants to exercise at this age. Amazing.
So the balance system is entirely a natural mechanism. And to maintain the natural mechanism, as it deteriorates its function over the aging process catch up, so that can be compensated by doing exercises. All these exercises which involve all the joints of the body, ultimately, it leads to a increased compensatory mechanism in the brain. So you do any exercise, and exercises which, you do more challenging exercises for the balance, say walking on the straight line, walking on straight line with the ball in the hand, that stimulates our equilibrium system to last longer. So how do you charge your mobile? The full battery. So you do more exercises, more charging will happen to the balance system.
Right.
Is that clear, sir?
Absolutely. Thank you very much, Doctor. One last question. This is once again, Mr. Lakshman, when I walk 7 kilometers a day, the music is on and it goes on for over an hour, and with the over-the-ear earphones, headphones.
With the insert phone on the earphone.
It's a headphone with
the headphone. Headphone is okay. Headphone is okay. But, while doing exercises, crossing the road, if you are too engrossed with that music, that can also invite some problem. So while crossing the road and you are too, engrossed with what you are hearing on the phone, and if you neglect what is happening on the road, can invite the problem. But the earphone per se, with the minimum basic volume, which is soothing to the ear, and the basic, minimize the duration, the exposure to the ear. The switch on, say, if you have 2 earphones, keep one phone like this. You start hearing with the one and make it alternate. So
Mr. Lakshman is crazy about Mohammed Rafi. So next time when you're walking, Mr. Lakshman, don't listen to Mohammed Rafi, because I know you will go crazy about him. Listen to some others' music and enjoy yourself. Thank you very much.
Thank you.
Thank you very much, Dr. Sanjay Helale, for
thank you so much.
I know I caught you while you were driving back from the hospital to home, but you were very sporting and you connected over there. Thank you very much to your office, to Mr. Pinto, and thank you to Nanavati Max Hospital for facilitating this. Thank you very much. And we will be back once again next Saturday, that is the 25th of February, with another session of Health Live at Seniors Today, as always at 5 p.m. Thank you very much.
Thank you so much.
Subscribe now and press the bell icon. Never miss an update.